this is a fight between life and death.
Cases of coronavirus, and there have been 121,000.
Millions of students will now have to stay home.
Hello and welcome. COVID is not just a health crisis, it's a child rights crisis affecting children's lives in all ways imaginable. With lockdowns being relaxed, things will improve, but will not get back to normal for a very long time, during which time lives, educations and futures will be lost. The greatest long-term impact of this pandemic will be on our children, with the health, nutrition, immunization, education, mental health and physical safety of our children being severely impacted. COVID-19 has only made a bad situation worse. Without our interventions and investments of ideas, of resources and of heart, these children will have no future. We need to reimagine tomorrow. We need to reimagine our children's future. As we begin this telethon, a reminder, India's Children's Day was on the 14th of November. The world celebrated Children's Day on the 20th of this month. Pranoy Roy and Nidhi Kulpati join me on this very special program.
नमस्कार। तो कोविड हमारी सेहत ही नहीं, हमारे बच्चों के अधिकारों के लिए भी घातक रहा है। इतने लंबे समय चले कोरोना काल में बच्चों की सेहत, शिक्षा, टीकाकरण, मानसिक और शारीरिक सुरक्षा पर भी असर पड़ा। वैक्सीन आने में हालात सामान्य होने में भी बहुत समय भी लग जाएगा। ऐसे में हम सबका दायित्व है कि बच्चों के भविष्य पर ध्यान दें। एनडीटीवी यूनिसेफ के साथ मिलकर इस सोच पर मुहिम चला रहा है, रीइमेजिन आवर चिल्ड्रंस फ्यूचर, ताकि कोविड के कारण उनकी टीकाकरण, शिक्षा, पोषण, पानी, सैनिटेशन जैसी सुविधाओं से वो वंचित ना रहे। यूनिसेफ करीब 70 साल से हमारे देश में 17 राज्यों में बच्चों से जुड़े विभिन्न क्षेत्रों में अपनी अनेक योजनाएं चलाता रहा है। लॉकडाउन के पहले चरण में 21 दिन के दौरान यूनिसेफ की हेल्पलाइन को करीब 5 लाख फोन कॉल्स आए, जिसमें बच्चों की मदद के सवाल थे। करीब 898 बच्चों की शादी यानी चाइल्ड मैरिजेस को रोका गया। कई बच्चों का स्कूल छूट गया क्योंकि परिवारों की आमदनी बंद हो गई। लड़कियों को ज्यादा खमियाजा इस समय भुगतना पड़ा। आंगनवाड़ी केंद्र बंद होने के कारण जो अच्छा पोषण जहां पर बच्चों को मिलता था, उनको कम ही मिला। यूनिसेफ ने 4 करोड़ से ज्यादा बच्चों को शिक्षा में सहूलियत के अवसर दिए हैं। तो अब आइए बच्चों को कारगर मदद के लिए आज की इस मुहिम से जुड़ें और योगदान दें।
Thanks Nidhi and Vishnu, and thank all of you, thank everyone for joining us in this very special UNICEF NDTV telethon focused on the children of our country. Now let's be clear, we're all fighting a war against this particularly dangerous enemy. It's dangerous because we don't fully understand it. We are learning, in fact we're also de-learning every day so much about this unseen enemy. It's been called the most dangerous battle we've all faced since the Second World War. But as we put all our focus into winning this war against the coronavirus, we're forgetting the one section of our society that is perhaps suffering the most, our children. We keep hearing that the virus attacks adults and the elderly, which is absolutely true. But while we focus on helping them in this battle, we tend to overlook that in many, many ways, this crisis is really hitting our children the hardest. For instance, UNICEF, along with the government of India, has every year vaccinated our children against so many different kinds of diseases, from smallpox to polio to cholera, typhoid, and many others, and many other kinds of medications. But now this pandemic war is disrupting normal supply lines, and children are not getting the vaccines they needed. That's just one example. Now, as the pandemic hits the medical system across the country, our smallest children aren't even getting the care and attention they need to save them from diarrhea, from malnutrition. Now, in any war, we all know the regulations of the Geneva Convention, which focuses on children at times of war. We need to remind ourselves that many of the regulations of the Geneva Convention must apply to our children in the war that we are fighting today. For example, the Geneva Convention says, Article 23, that children in times of war must be ensured medicines, food, and clothing. Article 24 of the Geneva Convention says, children that are orphaned or separated from their families must not be left to their own resources. And again, Geneva Convention Article 38 also makes it clear that children must get preferential treatment with regard to food, medicine, and other kinds of protection. This is so important today, and we must remember that our children must be given preference. It is perhaps this one time in our history, this moment, there's no bigger moment in our history than now that to remember our children. It is now in this war against the coronavirus. So please step forward and donate to help UNICEF and NDTV help our children, the children of India, and all our futures. Please step up.
This isn't the first time we've been faced with the unreasonable. For more than 70 years, UNICEF has been on the front lines of response, protecting children against preventable diseases. Together with partners, we wiped smallpox off the planet. We're doing the same with polio, reduced by 99% since 1988. We've also set ambitious targets for HIV/AIDS, committing to ending it by 2030, and we're well on our way. Our history says we can do anything we set our minds to. Big problems require big solutions. And we've got a big problem today. COVID-19 is one of the biggest fights in our history, with children caught in the crossfire. But we've got this. We're not afraid of hard work. Impossible is just a reason to try harder. We will respond. We will recover. We will reimagine a fairer world for every child. Please, join us.
That was in fact the voice of the one and only Liam Neeson. Wonderful to actually hear. Dr. Yasmin Ali Haq, country representative of UNICEF India, joins us. Ma'am, there are so many obvious and also hidden ways in which children have been affected by the pandemic. Tell us just how badly they have been hit. Why we need this campaign to reimagine a different tomorrow for them.
So thank you so much. Let me start by thanking you for joining us in this campaign. As we celebrated World Children's Day, it was a stark reminder for us that we have to address the crisis as a child rights crisis. We know that around 11% of the cases are of people under the age of 20. And children are directly affected, but the face is really one of an adult one. However, for us, it's really important that we see this, how child rights have been affected. Consider children whose parents have lost their livelihood, who have had to move from where they live to another place of shelter. Consider the 300 million odd children who are not in school at the moment. And not all of them, in fact, a very small minority of them are able to access online learning. Plus, as you were saying, the basic services that they did not have access to, the fear and stigma that is affecting them and their families. So for all these reasons, it's so important for us to bring the attention to children, because what affects them today can have a ripple effect for much longer. The type of psychological harm that children are facing. We, as you said, Childline has had more calls. So children are really being impacted by it, and it is in a way silent. And thank you for joining us and making this apparent. We have been working with the government, with civil society organizations to bring focus on the services that are needed. And we really look to other stakeholders to join us, because agencies like UNICEF, we rely on voluntary contributions, and every contribution you make really affects the lives of children.
Yeah, Dr. Yasmin, thank you. In fact, thank you for doing so much that you've been doing and with UNICEF all these years. Just can you tell us a little bit specific about what you're doing right now for children in this pandemic? And for example, when people donate, what will it be spent on?
Right. So a big part of our work is really supporting the frontline warriors, whether they're ASHA workers, Anganwadi workers, or school teachers or sanitation workers, who are spreading the message, who are communicating with all the communities to remind them of the very simple measures to prevent COVID, which means wearing your mask, maintaining your hand and your respiratory hygiene, and not going into crowded places. So we have reached over 650 million people with these messages. We've also worked very closely with, of course, the Ministry of Education at the national level and in the states to see children get access to remote learning. And we estimate that we've reached about 41 million children in this effort. We also know that as the services have reopened and the way we have worked with our counterparts and partners, around 20 million children have had access to some essential services that are needed to keep them healthy and to prevent malnutrition. And of course, malnutrition is an existing problem. So a lot of our effort is going into supporting children with malnutrition to be identified and that they receive the type of services that are needed. So those are some of the ways, including getting equipment for lab testing, for oxygen concentrators, for hospitals, by getting reagents that were needed in the early days to do the testing, and importantly, focusing on the psychosocial support care for children themselves, for their families, and for our frontline warriors.
Yes, absolutely much needed. Ma'am, please stay with us, Yasmin ji. We are just coming back to you. But in the meantime, let us hear now from one of the legends of Indian cinema, film industry ke Mahanayak, a powerful advocate for children who also happens to be UNICEF Goodwill Ambassador, Shri Amitabh Bachchan.
Namaskar, this is Amitabh Bachchan. You must have heard these words several times. Do boond zindagi ke and 5 saal 7 baar. I hope you remember what they mean. Yes, I'm referring to life-saving vaccines that all children must get to protect them from preventable diseases. Immunization acts as a protective shield, keeping not just the child, but also families and communities safe. Imagine how wonderful it would be if in our country all babies and children are fully immunized against all preventable diseases. Sounds like the future we would all want for every child. This World Children's Day, let us all join together to reimagine a world where every child survives and thrives, is healthy and immunized. To reach this goal, we need to work together, all of us, especially now, during and after the COVID-19 pandemic. Children need their vaccines, and with lockdown parameters easing over, as a parent, I would urge you to please take your child for the scheduled vaccination to your nearest immunization session, health center, or hospital. Don't forget to take your immunization card with you. Always wear a mask, maintain physical distancing, and wash your hands frequently. Immunization has been at the heart of UNICEF's work over the last 70 years. It is an organization that has worked assiduously towards immunization for children around the world. No organization is better placed than UNICEF for the delivery of these vaccines. As a Goodwill Ambassador for UNICEF, it gives me immense pride to be a part of this great effort. Come, join in with me, and let us make a difference in the lives of all children everywhere. Thank you. Namaskar.
तो हमने अमिताभ बच्चन को सुना। अब हमारे साथ दक्षिण भारत की जानी मानी अभिनेत्री त्रिशा हैं। त्रिशा is UNICEF celebrity advocate. Trisha, you recently had a virtual field visit with child rights champions in Chennai who have been carrying your message out into their communities. You must have heard many accounts of what children had to go through in this pandemic and also how they dealt with it.
Hi, good evening, and thank you for having me here. I think it was a great opportunity by UNICEF to have organized this virtual field visit because usually every year we go and meet these children and we have such fun interactions with them. But this year, unfortunately, due to the pandemic, we couldn't. And so this virtual visit was as fun and interactive as it's always been when I've met them. And the best part about it was not only were the problems being addressed, but there was a solution to every problem. And these children discussed various initiatives that they had undertaken to overcome issues such as stigmatization, raising awareness towards COVID-appropriate behavior, mobilizing community against child marriage, and writing petitions to the chief minister requesting for adequate transportation support because they wanted to attend the annual examinations. In fact, two of these kids, Altaf and Sangamitra, they went out of their way to make short films using their mobile phones to dispel stigma and discrimination against those infected with COVID. And they made sure these films went viral by sharing them on social media and their WhatsApp community groups to raise awareness. In fact, Altaf also made a second short film which showed us how inaccessibility to smartphones and laptops were forcing girls to quit school and start working with their parents. And there was another child called Madan, and his story was so endearing. So he and his friends heard about child marriage that was going to happen in their community. So what they did was they made this little street play, like a skit, showing the dangers of child marriage. And it was a win because there's no child marriage in their community anymore. And they stopped the one that was happening because they raised awareness through this street play. And in fact, Madan told me he was aspiring to be the chief minister and Altaf wanted to be a filmmaker, so they could put their talents and capabilities to good use. And to me, these kids are the true child rights champions.
Absolutely, absolutely. Wonderful, wonderful to hear this. We got so much to learn from our children. And with your on-ground experience and Yasmin, all the experience you've been getting over the last 8-9 months, Dr. Yasmin, what What's still the gaps, and what worries you, and what needs to be immediately done, do you feel? What worries you right now?
So I think my biggest worry is, we heard from Trisha the beautiful way in which children have not stopped dreaming. They have not stopped aspiring. And we have to keep that going. We can't afford for our children to be down, for them to not see hope. And for that, it's really important that we make sure that they remain in a learning environment, whether it's in home, whether it's on some remote device, or there are volunteers in the community who are helping them. It's crucial that we keep their aspiration, their curiosity going. The second area I would say concerns me is, how do we make sure that they don't fall deeper into any health problems, or children who are malnourished already fall deeper into malnutrition? Because we have worked so hard in India, the families, communities, the frontline workers, everyone has worked so hard to bring us to a level where we're really getting close to the targets we're setting ourselves. But if we don't pay attention to that, we're going to slip back, and it will be the children who suffer. Right. It's not just numbers. Every number, there are millions of children behind that. The third area I would say is, we have to address the violence, abuse, and neglect, because we know it's hitting kids, and the pandemic is causing it to hit even harder. We do need to keep the services that are needed to support these children, at the same time promoting a caring and supportive community, so that children are not frightened. The fear factor and the stigma that goes with it. We heard from Trisha the beautiful examples of where children are taking action. Yeah. And that's something that's a great opportunity.
Very inspiring, actually. Yeah. And I guess we're a little bit worried right now about pandemic fatigue, and everyone is, and youngsters wanting to just get back to living. But Trisha, it was wonderful to hear from you, and a lot of people listen to your words very carefully, and they take what you say seriously. So be careful, because I'm going to ask you, if you had one message to give to all our viewers at this time, what would it be at this crucial moment?
So Dr. Yasmin has, given us a very holistic view of the issues faced by children today and what is the need of the hour. So I would like to echo and elaborate on two of her points, which calls out to people to reimagine a different tomorrow for India's children. And the first point being is to support communities and organizations such as UNICEF, which help reduce the digital divide, so that homes or villages which have no or minimal access to technology can continue with their education. Millions of children are losing out on school hours, and they lose out on their talents because of this, and capabilities and opportunities. And children, especially from vulnerable communities, are at higher risk, at being pushed to child labor and child marriage and child trafficking. So the second message is to end violence against children in schools, institutions, workplaces, and communities. So I feel we all need to act decisively and in unity to stop and end violence against children. And this can happen not only by strengthening the national child protection systems, but also by addressing mental health issues and, trying to change these intricate social norms which continue to attribute low value to children and normalize violence in India. I think we need to, and we owe it to our children, to give them a happy and a healthy upbringing. And most importantly, they need to feel safe. So we need to work towards giving them this safe environment.
Right. Trisha, thank you so much. And Dr. Yasmin Ali Haq, thank you as well. Prannoy, we believe you have an announcement for us.
Yeah, I've just heard something amazing. An anonymous donor has agreed to donate for this fantastic cause 50 lakhs and will remain anonymous. Now that is fantastic.
Yes, absolutely. That's lovely news. तो जैसा आपने डॉक्टर यास्मीन अली हक को सुना कि स्कूलों के बंद होने से करीब 28 करोड़ बच्चों की शिक्षा प्रभावित हुई है। इनमें से कई शायद कभी भी स्कूल ना जा पाएं। इस त्रासदी में डिजिटल डिवाइड भी सामने आया। 4 में से सिर्फ 1 बच्चे के पास ही डिजिटल डिवाइसेस और इंटरनेट की सुविधा है। और शेड्यूल्ड ट्राइब्स और शेड्यूल्ड कास्ट जो समुदाय हैं शिक्षा के क्षेत्र में सबसे ज़्यादा प्रभावित हुए। इनमें से कई पहली बार स्कूल जाने वाले बच्चे थे। लेकिन उड़ीसा से एक बेहद खास खबर आई है जहाँ पर स्कूल ही बच्चों तक पहुँचा है। देखिए ये रिपोर्ट।
The Odisha government provides education to 6.5 lakh children who are housed in 6,700 hostels with around 3,500 schools. But as the global pandemic hit, these schools were the first to shut. The government knew they had to step in immediately. The alternative learning and mentorship program was conceptualized and rolled out within 3 to 4 days, covering 3 lakh children from SC/ST communities.
Then we decided to have our teachers go as mentors to the villages. What was more important was to keep the child connected to the process of learning.
The commitment of the teachers has also been instrumental in the success of the program.
जब पहले ये प्रोग्राम शुरू हुआ तो जो गार्डियंस थे वो बिल्कुल भी तैयार नहीं थे अपने बच्चों को छोड़ने के लिए इस कोविड की वजह से। फिर हम लोग यहाँ आए, हमें बहुत सारा प्रॉब्लम्स भी हुआ। फिर हम लोग को उनको कॉन्फिडेंस पे लिया, उनको समझाया कि देखिए कुछ चिंता करने की जरूरत नहीं है।
Not just tribals, students of all categories have benefited from the program. Students like Raman Palta Singh and Straboni Champati are the success stories. Both have continued their education in very challenging circumstances.
ଆମ ଘରେ ମୋବାଇଲ ନଥିବାରୁ ମୁଁ ପାଠ ପଢି ପାରୁନାହିଁ। दीदी मेंटर क्लास आसुथिबारु मु दीदींको फोन रे पाठ वीडियो देखि पारुची।
मत लागुनी कि स्कूल बंद होईची, मतलब सब दिन मु स्कूल जाउची। काली भी जदि स्कूल फिटबो ताहले मु काली ठु भी मन खुशी रे स्कूल को जीबी।
2 ways that UNICEF has supported this program has been by doing a third-party assessment for us. It was a rapid assessment, and then they were able to help us in conducting the capacity-building modules for our mentor teachers.
The alternate learning and mentorship program, targeted as an intervention for the scheduled tribes and also scheduled castes community, is actually ensuring that students here continue their education even in the middle of a pandemic when schools are closed.
Well, joining us now, Suman Sachdeva, an education specialist with UNICEF India. Thank you so much for joining us this evening. Tell us a little bit about the learning crisis that this pandemic has inflicted on our children.
Okay, school closures in India really are threatening the futures of millions of children here. And the most marginalized are paying the heaviest price. I'm actually referring to 286 million children in India. Most of them are from the marginalized sections, missing on classroom-based learning. These are the children I'm talking about coming from remote villages from a state like Rajasthan, which is rampant for its child marriages and for poverty. Or the children who are in the tribal villages in Jharkhand. Or the children from indigenous communities in Gujarat and Assam. Or Busahars, the poorest of the poor in Bihar. Or the children in urban slums in Maharashtra. You see, India is the land of diversity, and so is the diversity in this marginalizations of community and children. Pandemic has hit all of them, irrespective of caste, class, gender, or location. We're seeing that COVID-19 has deepened the learning crisis for all children, and it has both immediate and long-term impact on learning of children. Closing of Anganwadis, schools, all kind of institutions have really put a brake on all forms of learning in India. Efforts are being made to continue learning using digital technology, as you may have known. But this has also brought to the fore a deep digital divide.
बिल्कुल सुमन जी, आपने डिजिटल डिवाइड की बात की है, तो जब हालात इजाज़त देंगे इन बच्चों को स्कूलों तक कैसे वापस लेके आ सकेंगे?
तो बच्चों को स्कूल लाने के लिए बहुत केयरफुल प्लानिंग करनी पड़ेगी और कुछ ऐसे मैकेनिज्म्स लगाने पड़ेंगे जिससे कि जब बच्चे आए स्कूल उनके लिए बिल्कुल सेफ हों। ना केवल वो ही, हमें पेरेंट्स के साथ भी काम करना पड़ेगा। उनको ऐसे इंसेंटिव देने पड़ेंगे कि जिससे पेरेंट्स पहले तो कॉन्फिडेंट हो कि जो हमारा बच्चा स्कूल जा रहा है वो सेफ है, और मोटिवेट हो कि हमारा बच्चा स्कूल जाना चाहिए। हमको इसके लिए बहुत एफर्ट लगाना पड़ेगा। उसके लिए ये करना है कि हमको टीचर्स को ट्रेन करना पड़ेगा कि किस तरह से स्कूल खोले जाएं और सेफली खोले जाएं, किस तरह से लर्निंग सपोर्ट करी जाए, क्योंकि अब वो पूरा वातावरण बदल चुका है। जिस तरह से स्कूल पहले थे अब वो नहीं होंगे। तो इस ट्रांसफॉर्म लर्निंग एनवायरनमेंट में टीचर कैसे पढ़ाए ये सिखाना पड़ेगा। जो बच्चे आते हैं और जिन बच्चों को रिस्क होता है ड्रॉप आउट होने का, उनको ट्रैक करने का, उनको मॉनिटर करने की बहुत ही जरूरत पड़ेगी। पेरेंट्स और कम्युनिटी का सपोर्ट बहुत इंपॉर्टेंट है इस बात में, खासकर वो बच्चे जो अभी बाहर है स्कूल के और पहले भी बाहर थे स्कूल के। इसलिए हमको स्कूल मैनेजमेंट कमिटीज के साथ काम करना पड़ेगा और कुछ ऐसी सोशल बिहेवियर चेंज कम्युनिकेशन स्ट्रैटेजीज लगानी पड़ेंगी जिससे कम्युनिटीज खुद जागरूक हो और अपने बच्चों को स्कूलों में भेजें।
I just before coming to the question to you, Suman Sachdeva, I just want to thank that anonymous donor again and again and again for 50 lakhs. God bless you, and it's amazing that you want to be anonymous, but it's just wonderful, wonderful gesture. Thank you very much. And all of you, if you want to, don't have to give 50 lakhs, 500 rupees, 1,000 rupees, 5,000, 10,000, whatever you have. Please donate. This is a time you can help your children. So my basic question to you, Suman Sachdeva, is that as an educational specialist, our viewers will wonder, okay, if I'm interested in education as a viewer and I'm going to put the money to UNICEF, how will it help UNICEF and how will it be actually used?
As UNICEF, we are providing support to the national government and to 17 state governments, not only to prepare schools for a safe reopening, but also for continuity of learning and provision of learning opportunities at home for those children who are unable to come to school. In this way, we are hoping to target at least 60 million children in these 17 states. UNICEF will support governments to address the digital divide so that every child can learn digitally, but those who cannot, who do not have these resources, we will reach out to them through other means, television, radio, other digital means, multiple pathways, and even outreach strategies. We will work to provide life skills. As I said, these are most necessary for children to address their vulnerabilities.
Right. Ms. Sachdeva, great to hear so many of those ideas which UNICEF wants to implement on the ground, and thanks so much for sharing that with us. We're now joined by Sindhu Gangadharan, Senior Vice President and Managing Director of SAP Labs India. Thanks for joining in. Can you tell us a little bit about your partnership with UNICEF?
So SAP's strategy is to help every business out there run as an intelligent enterprise. And as you know, we are a market leader in enterprise application software, and we take great pride in the fact that 77% of the world's transaction revenue touches an SAP system. Right. So SAP and UNICEF have a 3-year partnership to ensure that we offer continuous education for children and also looking at ways to augment and create innovative career pathways for youth across the country. And at SAP, we are absolutely convinced that digital inclusion is the foundation for equitable as well as inclusive growth. Now, together with UNICEF India, we will impart employable skills to over 1 million youth across the country. And together with UNICEF, we will also enable the youth with job-specific skills, which will make them ready to meet the needs of the future workforce. Further, SAP will be part of Generation Unlimited, which is a platform incubated by UNICEF, and this will help us to support and create an ecosystem for youth empowerment. And the other highlight of this collaboration is to also support some of the key government initiatives, like, for example, Digital India.
Sindhu, you just mentioned that 10 lakh youths will be supported. Can you tell us how SAP will support young people, especially in these times of COVID-19?
Yeah, so due to the COVID-19 crisis, we all know that uncertainty prevails over both career as well as entrepreneurship opportunities that exist out there. So we therefore need to ensure that the youth get the needed guidance as well as the mentorship that is so much needed in these times. So what we're going to do is we're going to target those young people whose learning, training, as well as their employment opportunities are significantly being impacted by COVID-19. So how are we going to do this? So we're going to do this by enabling career guidance together with experts as well as mentors and provide mentorship for workforce readiness. And beginning 2021, SAP and UNICEF will explore ways to integrate digital literacy into our already existing offerings. And SAP in partnership with UNICEF will also support national level policy as well as advocacy interventions to reach over 1 million young people through various states as well as the central government. Also next year, we will activate an initiative which is very close to my heart, which is called Girls Power Tech. And this initiative is targeted at offering an internship right here at our campus at Labs India for the socio-economically underprivileged as well as the disadvantaged young women. And we will leverage the partnership with UNICEF under our award-winning Code Unnati initiative to create a bright future for the next generation.
Sindhu, that sounds absolutely exciting, and that partnership with UNICEF has quite a lot in it. Thanks so much for sharing that message.
Shaheen Mistry, CEO Tech for India, has sent us this message on how we can get our children to overcome this learning crisis.
Our kids need to keep learning at this time more than ever before. What's really getting in the way of that is hardware and putting hardware in the hands of kids, especially kids from low-income backgrounds. However tough it is, we need to do this. We need to raise the funds. We need to get hardware to them. We need to figure out security on those devices. We need to figure out how to teach our kids in ways that not only continues their academic learning, but really finds ways to build culture, foster well-being, and really meet the needs that our kids have. Leadership is really required today in this time more than ever before. Our kids don't just have learning needs, they have well-being needs. They're worried, they're stressed, they're exposed to all of the issues of isolation, they're exposed to higher levels of violence. We need leaders for our children who will talk to them, who will listen to them, who will help them find solutions, and who above all are going to do whatever it takes to keep them learning.
So let me just say that Shaheen Mistry, CEO for Teach for India.
All right, well, joining us now, Nidhi Aditya Nataraj, the CEO of Kaivalya Education Foundation and the Piramal School of Leadership. Thanks for being with us this evening. It's just, it's such a wonderful cause, I'm sure you'd agree. The latest ACER, or Annual State of Education report, that's conducted by Pratham, the NGO Pratham, speaks about the massive digital divide in India, and that the burden of this divide is being carried by kids, by children who don't have access to online classes. They don't have devices that they can rely or receive learning material on. Now, you've worked on reducing school dropout rates. How can foundations like yours play a role in helping to overcome what seems like an almost impossible learning crisis?
Thank you very much for supporting this amazing cause, NDTV. It's really, really important. I'm actually dialing in from a tribal district at the moment in southern Madhya Pradesh. And just today I went and saw a few schools here to see whether there's even a possibility to reopen and speak to communities about whether they feel safe about sending their children. And the clear answer is people are afraid. Just get into the mindset of the average girl child here. Her father has just lost his job in Surat or in Baroda and has come back. She doesn't know why he's back. He's stressed. He doesn't know whether he should go back or not. That stress is inside the household. She doesn't know how to pick it up. So it's not just about learning. The first thing that's important for any learning is that the child feels safe, the child sees hope in the future, and that's not what she's seeing today. I've worked in crisis, post-earthquake, post-floods, post-communal riots. And the first thing is that children, once they're afraid, their brain just freezes. Right. and they're just not able to learn. So I think until we tune into how children are feeling, the psychosocial emotions they're feeling. So we're running a whole bunch of classes for art, for sports, for just children to get together and reimagine that things can be okay now. Even you and I need motivation. Children need it 10 times more than we do. And only then can real learning restart. Maybe for grade 9, 10, 11, 12, we can restart learning, but grade 1, 2, 3, 4, 5, really, really important that we focus on socio-emotional learning, psychosocial healing before we get into learning. Otherwise, what is going to happen is children are not dropping out of school, they're just afraid of school. That's what's going to happen.
Yeah. No, I think that's so important. The need for our children to feel happy about themselves, the psychosocial aspects of what you're saying, the healing that needs to be a real factor in all of this, so important, absolutely critical as we try and return to normalcy. When will that happen? That's still a question mark. Thanks so much. Kareena Kapoor Khan, the UNICEF celebrity advocate, joins us on our program this evening. She's got this very special message. Listen in.
I'd like to wish everyone a happy World Children's Day. But this year, as you all know, schools have been closed for more than 7 months due to the pandemic. Children are missing out on essential learning. The chances are that many of them, especially girls, are not likely to ever go back to school. UNICEF is working with the government and partners in many states to reach these vulnerable children, adopting innovative ways to ensure continuity in learning at home. You can contribute too by supporting UNICEF through your voice, time, and money. Join me, Kareena Kapoor Khan, to make a difference for every child.
Great to hear from Kareena Kapoor, but I must say that Aditya Natraj said some really important things, and his work on the ground is obviously so wonderful, and to hear those inspiring stories and what really matters, the children there, they get terrified when they see their father come home. They don't understand. It was really, really moving, I thought, what he said.
No, absolutely. Well, the pandemic has disrupted the world that children are familiar with. In fact, what Prannoy is speaking about. It's also added a layer of complexity to what many were on the existing situation, but invisible crises, for example, mental stress, abuse, violence against children, child labor, trafficking, child marriage, these are real concerns now. In many cases, children have got locked in with their abusers. Isolation has created even more anxiety, as has the shutting of schools. But there's an emergency service provider for such cases, Childline, which is partnered by UNICEF.
Since mid-March, Childline has answered nearly 30 lakh calls and carried out 2.25 lakh interventions. Of these, about 57% of the interventions have been classified as COVID-related assistance. Another 21% of the interventions are for key child protection concerns. These would cover the entire gamut of offences like child sexual abuse, child marriage, physical abuse and the like.
अगस्त 2019 में चाइल्डलाइन को ऐसी जानकारी मिली कि 6 साल की बच्ची जो है वो डिस्ट्रिक्ट हॉस्पिटल में एडमिट है। हॉस्पिटल जाने के बाद ऐसे पता चला कि लड़की की हालत बहुत बुरी तरह से हालत खराब है, उसको मेडिकल की ज़रूरत है। उसके बाद उसको मेडिकल ट्रीटमेंट दिया गया और अधिक जानकारी के बाद ऐसे पता चला कि ये लड़के ने लड़की के ऊपर लैंगिक अत्याचार किया है। तो उसके बाद उस पर 20 दिन तक उपचार किया गया। इस 20 दिनों के अंदर लड़की को काउंसलिंग करना, भावनिक आधार देना, उसके साथ खेलना, ये जो एक्टिविटी करने में हमारे साथ और 2 टीम मेंबर थे जो उनके साथ 24 घंटे तक रहते थे।
20 दिन के बाद में जब वो बच्ची की ट्रीटमेंट ऐसा लगा कि अब शी इज़ ओके, वी कैन मूव हर, तो इन बिटवीन हमको पता चल गया था कि वो अमरावती डिस्ट्रिक्ट से है। इसलिए हमने अमरावती के चाइल्ड वेलफेयर कमेटी से हमने कांटेक्ट किया और फिर उस बच्ची को 20 दिन के बाद एम्बुलेंस में चाइल्ड लाइन के बच्चों के साथ में उस बाल कल्याण समिति के सामने हमने भेज दिया। वहाँ से उसका बालिका गृह जो है वहाँ पर उसका एडमिशन किया गया। उसको स्कूलिंग की फैसिलिटी मिली, रहने की, खाने की सब व्यवस्था, कपड़े सब उसको मिला। बच्ची एकदम सेटल्ड है और वो वहाँ पर अच्छे से रह रही है।
Well, joining us now, Tanishta Datta. She's a child protection specialist with UNICEF India. Tanishta, the first thing, one of the unintended consequences of the lockdown was the many silent pandemics that it's triggered for some of our most vulnerable, our children. Now, these are the less visible consequences, as we've been saying, but they affect children massively. Could you tell us, give us a few examples, tell us about how this is very much the case?
There is no doubt now that the COVID-19 crisis has actually transformed into a child rights crisis. Children and young people are going to see the impact of this pandemic in various ways. And unless we are able to respond to this now, I think the long-term consequences will be tremendous. The very measures that are put in place to control a pandemic like this, the lockdown, the closure of services, the restriction of movement, are also the exact same things that are triggering this crisis even more. So we are seeing increases in child labor, marriage, increase in violence against children, mental health stress of children. The thing about child protection is that unlike many other issues, it is not unidimensional. The deprivations are multiple, and sometimes the deprivations are all happening to the same child. For example, the girl who's living on the street, who's being maybe abused sexually by somebody, is also working to survive on the street, is also at risk for being trafficked for sexual exploitation maybe. So all these layers adding up and the reach of services being restrained, it has created this whole concoction of what we are calling the shadow pandemic.
Absolutely. Tanishta, what difference will the funds raised in the show make to children?
UNICEF India has been at the forefront in responding to this child protection crisis, or the shadow pandemic as we are calling it. In the last 8 months, we have been able to train more than 150,000 frontline child protection workers and service providers on COVID risk mitigation strategies and their roles in preventing violence, exploitation and abuse of children. We have been able to support 11,000 functionaries of Childline with PPE kits so that they could act safely as the frontline responders during the lockdown. We have also reached almost 4 lakh or 400,000 children and their families with psychosocial support in partnership with Childline and NIMHANS, and about 2 million adolescents with messages on COVID risk mitigation. We've also been able to reach out to more than 5,000 children who are in the alternate system without adequate family care, with additional protection services to maintain their safety net. And we would like to use the funds that we are able to generate through the support of everyone here today to redouble, or triple, or amplify our efforts to be able to reach the most vulnerable child and to create a safety net for children that prevents them from any risk of further harm, abuse or exploitation. So thank you so much for your support.
Thank you, Tanishta. Thank you for explaining the problem areas and the work done till now. And now Ayushman Khurrana, UNICEF celebrity advocate, has sent this message for our campaign tonight.
Hi everyone, we know COVID-19 has not been easy for anyone, and especially children, making them more vulnerable to violence. We can prevent this by being aware and protecting those around us. And as men and boys, we have a responsibility to be better role models, because we know often it is we men who are perpetrators of violence. As a UNICEF celebrity advocate, I'm committed to ending violence against children and would like you to join in doing so. You can support UNICEF by lending your voice, time or money. Every support counts. On this World Children's Day, let us pledge to end violence against children.
So now we have Atya Bose with us. She's the Executive Director, Angan. Atya, thank you for taking out time. You've been working on the issue of child protection for years. We've been talking about how the pandemic has had a massive setback for our children. Tell us about Angan's work during this period and what have been your priorities?
Well, first of all, thanks very much, NDTV, for putting a spotlight on something that is really a very, very, very critical and serious issue. I think it's important to acknowledge right up front that the crisis of child protection, the crisis of children's safety and children being harmed, is not a new crisis. You know, India has been a global leader in child marriage, in child labor, in child trafficking long before the pandemic hit. What the pandemic has done is that it has exacerbated this to levels where today we can actually have this national conversation, this, dare I say, this long overdue national conversation on a very, very, very critical issue. So, you know, really, thank you very much for doing this. So in terms of what Angan has been doing, you know, I think our understanding, like the understanding of most people who work in child protection, is that vulnerable children come from vulnerable families. You know, children aren't like in a vacuum. So you really do have to focus on strengthening families, on looking at family vulnerability. At the time of this of the crisis, when government has been quite honestly absent, you know, in terms of protection issues, they've been very concerned, obviously, with COVID and with the other issues, as Tanisha pointed out. You know, treating the pandemic has caused all sorts of restrictions and has caused the removal of whatever scant government support there was for all of these issues. So a lot of our work has really always been, and intensified more so even now, on how, where children are, how do we have people there to protect them? Because child protection at the end of the day is not a bunch of laws and policies. Child protection is a human system. It requires bodies on the ground. Right. So our work has always been, you know, we work with about 6,000 women in the 1,100 villages and bastis where we work. And these are women who really have just said, they've joined us because they've said, जो हमारे साथ हुआ है, ये हमारे बच्चे के साथ नहीं होना चाहिए. Right. You know, so they've really just been working, you know, very hard to stop all of the things that have happened with them.
But Atya, let me ask you
this. A key focus at the beginning, sorry?
Let me just ask you this. You've been working on demonstrating the power of the non-expert in a community-based prevention model to combat serious child harm. What is that power of the non-expert? Does that include each and every one of us?
Of course it does. The power of the non-expert is really the power of all. You know, what is the one thing, Vishnu, that we all have in common? We've all been children, right? That is the one thing that we all have in common. And if we allow ourselves to stop and think about what it means to be a scared and vulnerable child, dependent on other people, then we understand that we do know. You don't need to be an expert. You know, we function on the premise that protecting children is something that the police should do, is something that a psychologist should do, is something that somebody else should do. It's not. Protecting children are everywhere, and child harm is ubiquitous. It is everywhere. It is only when all of us are involved, when we are alert, when we agree to amplify the voices of children, of the exploitation that they face. That is how we leverage our power. So, right. You know, what can you do as a neighbor? What can you do as a brother, as a sister, as a father, as a community member, as a person of means, as a person who, you know, has access to things? There is something all of us can do, right? So we really believe that only when child protection becomes everybody's business, literally everybody's business, that children will be safe. And the way we do it is that we actually just work with, you know, women, mothers in very, very poor communities who've said that, you know, this is how we're going to, this has to end. So if people in very marginalized and very poor situations can actually say that we are going to stop the exploitation of children, then, you know, I think the point is very clearly that all of us can do it. All Absolutely. Of us have a very important role to play. What does that mean? It means when you see a child around you, you don't look away and expect that somebody else is going to do something about it. Right. It means that you actually report it. It means that you talk to the child. Yes. It means that you find out about it. It means that you follow up on it. Yes, it will take a few minutes of your time. It will require you to make some calls. But that's what children need.
And I think that's a key point. You know, the fact that, again, the question which we started on, you don't need to be an expert to be doing this. You don't need to be a child rights activist to be doing this. You need to be doing this as a human being, as a citizen and as a human being. You know,
and you have to recognize, and you do have to recognize that it is a very, very, very serious crisis.
Yeah. No, it is
and
indeed.
It requires all of us to make it our responsibility. Yeah. That's what's going to make the difference, pandemic or not.
Atya, it's always wonderful speaking to you. Thanks so much for joining us this evening. Well, we've got a wonderful, wonderful guest joining us now, Justice Madan, the former judge of the Supreme Court of India. Thank you, sir, very much for being with us. Justice Loker, as a crusader of child rights over so many years, with the kind of economic setback this pandemic has meant and the challenges to education that we are seeing, what are some of your biggest concerns going forward?
Well, there are, many of them. Education, of course, is one of the primary ones. Immunization of children is another one. You have issues of missing children. You have issues of domestic violence, child marriages. There's no shortage of issues. One of my concerns also is that, some of these institutions under the law, for example, the juvenile justice boards, they're having problems trying to cope with cases that come before them because of the pandemic. Similarly, child welfare committees are having problems in dealing with the cases that come before them of children who are in need of care and protection. So really, it's a whole range of issues. Child labor is also one of them. There are many of them.
All right, Justice Lokur, it's just wonderful to have you on this telethon. Thank you very, very much for joining us. Thank you. As you just said, and what Atya both said before, there are many laws, there are many regulations, there are many issues that are available in the books on child rights. But at a time when there's such a crisis, they can be kind of ignored a bit and put on the back burner. How do we make sure that these are not forgotten and they're actually implemented and children are not put on the back burner?
Well, there has to be continuous awareness programs. For example, the police have to be trained. They have to be educated on issues pertaining to children. The judiciary has to be trained. They have to be sensitized about the rights of children. People from society, from civil society, they must also know. For example, issues of child labor. If people are told that child labor is illegal or it should be discouraged, I'm sure they'll react positively. One thing is to know that it is illegal, but the other is, to be a little more proactive and tell people that, listen, you have to stop it, and you have to, perhaps go out of your way to try and stop it. So really, awareness of child rights is, I think, very, very important. Educating people, different sections of society, like I said, even the judges, police, just about everybody. Yeah.
Sir, thank you so much for sharing those thoughts. It does seem very often to be such a formidable task. It's so daunting at so many levels when we go about it. But thanks very much for sharing some of those concerns and your encouragement for this cause. It means the world to all of us.
बहुत बहुत धन्यवाद साहब जुड़ने के लिए। तो वाकई में जिस तरह से जस्टिस लोकर जिस तरह से कह रहे थे कि हमें लगातार अपने बच्चों के अधिकारों के बारे में जागरूकता फैलानी है, उनको जागरूक करना है। टीकाकरण, इम्यूनाइजेशन एक बहुत बड़ी समस्या रही है और भारत में टीकाकरण का कार्यक्रम दुनिया में सबसे बड़ा है। हर साल करीब 10 करोड़ बच्चों और गर्भवती महिलाओं के टीकाकरण की योजनाएं होती हैं, लेकिन अब कोविड त्रासदी के कारण अब तक बरसों की जो मेहनत है वो कहीं रुक ना जाए, क्योंकि बच्चों के टीकाकरण में भारी कमी और रुकावटें देखी गई हैं। ये लड़ाई डोले सिंह जैसे लोग पहले से ही चला रहे हैं। एक रिपोर्ट देखिए।
मैं 4 बजे उठता हूँ सुबह, तो 5 बजे वैक्सीन पीएससी में भरनी, फिर 6 बजे गाड़ी लेनी, 7 बजे पहुँच झूले के पास। तो इतना कर टारगेट हम चाहते हैं कि MRM मेजल रूबेला जो से फ़ायदा जो बच्चों को 9 महीने से 15 साल तक जो मेजल रूबेला फैलती है तो वो जड़ से पोलियो की तरह ख़त्म हो।
Well, we've got a very special guest joining us now, Luigi Aquino, the Chief of Health of UNICEF India. So there have been disruptions in the delivery of immunization services which have been caused by the pandemic. So everything that organizations such as UNICEF have worked towards in the area of child immunization could actually be sliding backwards, and that's a real worry. How would you tackle that?
I think countries around the world have learned and experienced different degrees at different times of disruption of services, health services in particular for women and children, of course including immunization. Now, the good news in a way is that as we continue, I think we are now in 1-year journey through this pandemic, as we continue living with this pandemic, we also improve day by day in living with it and adjust our lives to it. So the level of disruptions that has occurred in many services in a way has been very strong in the beginning during the lockdowns and when everyone was caught off surprise and all the systems, social, economic systems were disrupted in many countries. As this moves, we see more and more that, again, we are adjusting and making better progress in resuming services. In this regard, immunization is a great example compared to other services for what we know, in that it has been, in a way, faster and very effective in restarting the services after the lockdowns or even during.
Yeah, very, very, very interesting. Luigi, thank you so much for being with us. I wanted to ask you a question, but before that, you'd be glad to hear, since we are talking about immunization, Adar Poonawala, whose Serum Institute of India is the world's largest manufacturer of vaccines by number of doses produced, has also sent NDTV a message in support of this campaign this evening, Reimagining Our Children's Future. It's great to hear that. It just goes to show how really vital this campaign. Now the question is, how do we ensure that COVID immunization program, which is like highest priority, and in India it'll be in fact the world's largest ever immunization program, how do we make sure that this COVID immunization doesn't undermine all the other immunization campaigns that UNICEF and the government are doing for our children?
I think we first have to think that we're dealing with something unique and that immunizing children is not the same business about providing a new vaccine to a completely different group of people, which is largely going to be adults. So to some extent, the delivery machine or when and how and where the COVID vaccine will be offered and administered will not necessarily crash and overlap with what is the immunization schedule for children. Second, of course, you need to make sure you have enough inputs, the resources. One of the critical resources is the vaccinators. So the people who need to deliver the immunization for COVID-19 and for routine immunization. And in that regard, plans are already in place from the Ministry of Health to make sure and be sure that there are enough vaccinators across the board to provide the vaccine for COVID-19 without disrupting the routine immunization services. The other critical input you need is to preserve your cold chain system. So as I said earlier, vaccines do travel and need to be traveling across the country at a certain minimum temperature. Now, when you introduce a million of doses of a new vaccine in addition to what you already have for women and children, you need to expand your cold chain. And this is already being done. So as we prepare and very much to welcome this new vaccine, we are putting all the checks and balances in place to make sure that there is enough cold chain and cold storage capacity to accommodate both the vaccines that are the traditional ones for women and children and the new ones that will come for COVID-19.
Luigi, what difference will the funds raised in this show make to your work at UNICEF?
We at UNICEF have a dream, an aspiration and a vision. We will work and work to make sure that communities and families everywhere are aware of what are the key behaviors, what are the key practices they need to take to ensure healthy pregnancies, healthy delivery, and a good follow-up of the babies as they grow through their life. We work to have healthcare workers, nurses, doctors, and also the community healthcare workers well-trained, motivated, safe and protected during COVID-19 and ready to take action to support pregnant women, babies and children as throughout the stage of pregnancy, delivery, and then growth of these children. We work to make sure that equipment and supplies are in place, be it in a delivery room, be it in an immunization session, be it in a COVID facility. We work to support that agenda as well. And we work to ensure that technology is used at its best to track patients, to consult patients, and to use the data to better tailor healthcare to the needs of people. Of course, we don't do this alone. We are a small actor amongst many, but our small contribution will hopefully serve a much bigger cause.
Luigi, thank you so much for joining, Chief of Health, UNICEF India. And it was nice to know, as he explained, because we all are waiting for the vaccine, that how the cold chain systems will be maintained and they are being expanded. Well, we have another special guest, Vikas Srivastav, Managing Director, Johnson & Johnson. Thank you for joining, Mr. Srivastav. What sort of health initiatives is Johnson & Johnson's committed to?
At Johnson & Johnson, we believe that good health is the foundation of a good life. That starts at birth itself. Since 2008, we've partnered with Indian Academy of Pediatrics to address a critical concern in India, reducing infant mortality. And one of the leading causes of infant mortality is birth asphyxia, a condition where the newborn is deprived of oxygen at birth. Together, we've developed this program called Neonatal Resuscitation, through which over 200,000 healthcare professionals have been trained. And it has led to ensuring that at every delivery, the attempt is to have at least one healthcare worker trained in newborn care and in resuscitation so lives can be saved. And together with this program and the other initiatives of the government, we've seen the reduction in infant mortality from 2008 to 2019 to half the levels that were there before. The other area program we've been doing since 2014, partnering with the leading NGO, is how do we provide health and education support to low-income pregnant women and new mothers. And we do this through their mobile phones, through free voice calls and free voice messages, which helps them to learn on topics of interest to them, such as feeding, hygiene, nutrition, and also keeping their appointments for immunization and clinical appointments.
Mr. Srivastav, tell us a little bit more about Johnson & Johnson's partnership, the one you have with UNICEF.
As we talk about building a healthy future for our children, one of the most pressing issues in India is lack of access to menstrual hygiene education and products for adolescent girls. And we've been working with UNICEF in this area since 2012. And early research by UNICEF showed that during the periods, most girls lost at least 1 to 2 days in school because of discomfort caused by the periods, lack of education and awareness, and also fear of embarrassment. Together, we've developed a program called Paheli Ki Saheli, which incorporates inputs from parents and teachers as well. And the program teaches girls at school, improves their confidence, gives them access to good education, and that builds their confidence, that makes them attend school even during those days of the period where previously they were uncomfortable.
Well, that's a very interesting partnership that you have, and one that obviously affects so many lives. Thanks very much, Mr. Srivastav, for being with us. It's always wonderful to introduce Sharmila Tagore onto any NDTV program. She joins us now. She's a UNICEF supporter and an actor. Ma'am, the main focus of your support to UNICEF, and you've had this support for a while, has been promoting openness and awareness about HIV/AIDS and its impact on children. Now, it's a really tough fight that's been made even harder by the pandemic and the lockdown. Isn't that the case?
This has been a tough year for everyone, especially for children. In any pandemic, the children become the worst victims. They have no voice, so their plight often doesn't take center stage. We should put the children first. Schools have been, as you know, closed for more than 7 months, and that has impacted children greatly. And we've always known that children who are the weakest and the most susceptible suffer the most, and this includes the children living with HIV and AIDS. Families fear contracting the disease and are not venturing out, not even to get their children vaccinated. And then there have been the lockdown where access to services is restricted or simply not available. There are transport problems, financial problems, all of which prevent people from accessing the much needed life-saving treatment. Cases of HIV infections may increase in such a scenario.
Right. Sharmila Tagore, we've followed you for years and all your wonderful work on child rights and on children's health and other child issues, child-oriented issues. Given all your experience, you still never faced any crisis as bad as this, I bet. So with that experience and you're watching this crisis, what's the one big message and need that comes to your mind?
The pandemic has exposed the huge disparities in society. The scale of problem is not just limited to one aspect of life. Disruptions to key services and increasing poverty pose the biggest threat to children. The longer the crisis persists, the deeper the impact on children's education, health, nutrition, and well-being. The future of an entire generation is at risk. As duty bearers, we should put children first because they are the most vulnerable. We need to come together, support, take action to protect the present and the future of an entire generation. To the child, we cannot say tomorrow. Her name is today.
वाकई शर्मिला जी, बहुत बहुत धन्यवाद जुड़ने के लिए इस मुहिम के साथ। और अब एक और खास मेहमान डॉक्टर के श्रीनाथ रेड्डी, प्रेसिडेंट पब्लिक हेल्थ फाउंडेशन ऑफ इंडिया। थैंक यू डॉक्टर रेड्डी फॉर ज्वाइनिंग। According to you, what has been the biggest impact of the pandemic on the health and well-being of our children?
Well, we have seen physical, mental, social and economic effects on all sections of society, but they've been particularly accentuated in their impact on children. We know that children can get infected, though often not very severe, but they can also carry infection to others. We know that as far as mental health is concerned, there can also be a significant impact because of social isolation, being unable to meet their peers and play with them. Then you're also seeing social ills like child marriages, child labor. Then health services are also getting affected. Immunization services are suffering, and we are seeing sometimes immunization rates not being adequate. We see social services like midday meals in schools not being available, or if there is inappropriate nutrition because the supply chains have broken down and you're only having ultra-processed food. And with low physical activity, you can also become obese in childhood, so you can have malnutrition of both forms.
Right, Right. I just wanted to, sorry to interrupt. Dr. Reddy, I would say that you're probably one of the most respected medical professionals in India, and your foundation is doing great work. But at this moment, can you just specify and tell us in detail what kind of work your foundation is doing and you are doing?
PHFI has been working firstly by providing technical support to the governments, both at the central and the state level. It has also been training a large number of primary care physicians in delivering services across the country. But even with children, we have been working in producing an excellent booklet for children, which can be used by parents as well as schools for carrying the messages to children and providing them the appropriate kind of health education. We must remember that children also can be great change agents. If they are given the adequate information in the right manner, they can actually influence the elders in their home or even their relatives and friends, families, and they can actually ensure that even the elders follow the appropriate precautions. So both to protect the children and also to enable them to become effective change agents, we are really working in that area.
Well, that's incredible work, Dr. Srinath Reddy. Thanks so much, sir, for telling us a little bit about what you've been doing. Well, just to reiterate once again, without immediate funding and key life-saving interventions like healthcare, nutrition and immunization, an additional 1,600 children could die in India every day over the next 6 months as the COVID-19 pandemic continues to weaken health systems and disrupt routine services. Right through this program, this show, you've been seeing information on how to contribute to the UNICEF NDTV Reimagine campaign on your screens. But let's tell you very quickly how your contributions will be used. Now, your contributions could help ensure that children continue to receive life-saving vaccinations. It could help UNICEF reach even more children, for example, with education initiatives, help provide continued access to essential health, also nutrition services, or even help or even keep UNICEF's work with child protection initiatives like the Child Helpline going. That's really important. Now, it needs all of us acting now to reimagine a better future for India's children. That's what this entire telethon, this entire effort is all about.
Vishnu,
yeah.
Vishnu, in fact, that figure you just gave is 1,600 additional children are dying every day because of the pandemic, and we're not reaching out to them. So, I mean, it's staggering. In these 2 hours, more than 300 children, additional children have died. Died, and in these 2 hours of this telethon, 300 children. It's just awful, awful. It's a crisis.
Because health systems get weakened, and you know it's all linked up. It's the pandemic which causes so many other concerns simultaneously. Neeraj Jain, the India Country Director for PATH, with us at this stage. Thanks very much for being with us this evening. Now, everyone is waiting for the vaccine to come to save us, in a sense, return us to some sense of normalcy. Now, there are 5 vaccine candidates which are being tested in India, but even then, many challenges remain in the process of distribution, assuming a few of them are accepted by the regulator. Now, you are working with the government on this, the process of getting the vaccine when it's ready to the people who need it all over the country, not just the metros. Give us a sense of where you're at with that.
Thanks a lot. Thank you for inviting me to this important conversation. So, this is a very, very complex issue. Because firstly, there are 5 which are being considered in India, but we're kind of looking at this as a global issue and really talking to global manufacturers who are in multiple different stages of trials. And from those, we're still not sure what's going to hit us first and which vaccine will come. There was a lot of excitement a few weeks ago about the Pfizer vaccine, but temperature control and how cold chain is going to work is becoming a challenge. So a few challenges I just wanted to identify for the audience here. There's going to be a challenge around production capacity and how that's going to get divided between the different countries. We're not still sure what India will get. Once we know that, we would also have to figure out within India who gets priority and how do we make those priority lists. Already, Luigi talked about the fact that our immunization system is built for providing vaccines to small children and pregnant mothers. So, you're talking about a completely different audience. Not sure how we are going to be able to bring them in. So those conversations are on. Within that also, this is probably the first time where the demand for a vaccine will probably be much stronger than the supply that we have, at least to start with. So how are we going to balance all of these and move forward without actually creating some sort of perversion, ensuring that the logistics and the cold chain works, making sure that the people who have been identified as the front runners to get the vaccine for the rest, and really ensure that, we are able to create the protection that we need. So lots to think about.
बिल्कुल नीरज जी, how has the pandemic affected the health services? और आपने वैक्सीन की बात की, सब जानना चाहते हैं वैक्सीन के बारे में कि हमारे बुजुर्गों को पहले मिलेगी कि बच्चों को पहले मिलेगी. How have the priorities changed?
Nidhi ji, priorities have changed quite a lot actually. Unfortunately, when the pandemic hit, the entire health services of the country came to a standstill. And our frontline workers, who are really the backbone of our system, just got involved with the COVID response. And frankly, we didn't even really know what we were trying to do apart from just responding to an emergency that we were trying to still figure out. उसमें हुआ ये है कि जो immunization services थी हमारी, they came to a complete standstill. बिल्कुल सब कुछ बंद हो गया. The risk with that is that this is actually something to really think about. The risk is that जब essential services बंद हो जाती है, the risk is कि हमारी जो population है, जो बच्चे हैं, risk of them actually being harmed because of vaccine preventable diseases like diarrhea, like pneumonia, which is still killing about almost 500,000 children. And Pranay was talking about this just a little while ago, that COVID, we probably lost sight of that. So until the immunization services get online, until we are able to vaccinate every child, not just thinking about COVID, but the rest of the vaccines, we've got a dangerous situation on our hand. And I really think that's something that we need to think about. Also, the chances of vaccine manufacturers shifting production to COVID vaccine rather than continuing to produce the vaccines that our children need is another worry that actually stays at the top of my mind.
नीरज, बहुत बहुत धन्यवाद जुड़ने के लिए. वाकई जैसे डॉक्टर रॉय ने शुरुआत में कहा था कि हमारे बच्चों के लिए एक वॉर लाइक सिचुएशन है, तो हमें वाकई में उनको तवज्जो देनी है. बहुत बहुत धन्यवाद नीरज. तो अभी हम तक टीकाकरण की बात, वैक्सीनेशन की बात कर रहे थे, लेकिन पोषण भी एक बहुत बड़ी त्रासदी हमारे बच्चों के लिए समय सामने आई है. देयर इज अ क्राइसिस ऑफ malnutrition in India. Did you know that over 40 million children are chronically malnourished and that nearly every third child in India is undernourished? Now imagine what the pandemic and the subsequent lockdown did. But there are nutritional rehabilitation centers working hard to pull our children back from this nutrition crisis.
Vincent is 2 years old. He was found to be malnourished and has come with his mother Sarita to the Nutritional Rehabilitation Center at the district hospital in Chikbalapur.
ಪಾಪು ಹುಡ್ದಾಗಿಂದ ತುಂಬಾ ವೀಕ್ ಆಗಿದ್ದಾರೆ ಸರ್. ಪಾಪುಗೆ ಎಲ್ಲೆಲ್ಲೋ ತೋರಿಸಿದ್ವಿ, ಮೇಲಾಗಲಿಲ್ಲ. ತಿರ್ಗಾ ನಾವು ಊಟನೂ ತಿನ್ನಲ್ಲ, ಹಾಲು ಕುಡಿಯಲ್ಲ, ಹೊಟ್ಟೆ ಉಬ್ಬರ ಬರ್ತತೆ, ಒಂಥರ ಸುಸ್ತು ಬೀಳ್ತಾನೆ ಮಗ, ಭಯ ಬೀಳ್ತಾನೆ.
Asha workers and Anganwadi workers screen children under 5 and bring those with severe acute malnutrition or SAM to the center. The children are also admitted through OPD screening.
District Chikbalapura has 6% of severe wasting according to the NFHS survey. So for that we have trained our Asha workers and Anganwadi workers and all the grassroots level healthcare workers, so that they are trained in that, identifying SAM children.
The ward has 10 beds and was set up in 2012. Chikbalapur NRC was chosen for a pilot project for treatment of children under 6 months of age with severe malnutrition. UNICEF has provided technical support for this program, and has conducted training programs with the support of the National and State Centres of Excellence. Standardized protocols for feeding and online reporting have been provided in Kannada and Telugu. There is also strong support from state departments. Aisha brought her child, Rafia, to the doctor for a checkup and was told to admit the baby as her weight was very low. The baby is now well enough to be discharged.
कल डिस्चार्ज होने वाला है ना? डिस्चार्ज होने के बाद क्या करना है?
सेम अब यहाँ कैसा ही हमें घर में भी वैसा बच्ची को पकाना खिलाना.
The Nutritional Rehabilitation Center, giving malnourished children health and a better start in life.
So we have with us Vani Sethi, nutrition specialist, UNICEF India. Vani, thank you for joining. The reduced access to nutrition is also affecting maternal health. India loses 500,000 newborn every year, kareeb 5 lakh bache, which is the highest in the world. How do we address a neglect or the situation that is now worsened by the pandemic?
3 things need to be done. First, we need to prevent all forms of malnutrition through information access for ensuring good quality diets, nutrition services for children, their older siblings and their families, in their homes and in their communities nearby. Second, when prevention fails, treatment has to be ensured. And mothers and children that are suffering from acute forms of malnutrition and severe forms of anemia need help in their vicinities close by. They cannot travel miles and miles to health facilities which are already overcrowded and are responding to a health crisis to take care of the nutrition crisis. They need they need treatment in their vicinity close by. And third and most important, all marketing of breast milk substitutes, unhealthy, nutrient poor quality foods needs to be tightened up through strict vigilance and proactive role by the food business industry. So we need support to prevent malnutrition by diets, services and information where families play a role. Second, where prevention fails, treatment needs to be ensured by the government. And finally, marketing of unhealthy foods needs strict vigilance so that the food environment is conducive for good health and healthy lifestyle.
Healthy eating is so very important. Thanks very much for being with us and sharing that important message. We're now joined by Dr. Rajan Shankar, the Director of Nutrition at the Tata Trust. Now, Dr. Shankar, you've been a pioneer in the nutrition space for more than 2 decades. Tell us how big a setback the pandemic has been. Are you hopeful that we will sooner than later be back on track?
Thank you very much for having me on this show. And I'm quite optimistic. I know, as everyone mentioned, this is really a devastation. It has really caused that kind of a devastating increase in acute malnutrition. Even before the pandemic, we had pretty bad situation. This has further exacerbated and made things worse. But the point is that India has the infrastructure, and even though we have been laggard in reducing malnutrition, the point to mention is that there's not a single state where we had not seen progress. There has been progress. Somewhere it has been slow. In some places it has been much better. And our frustration has been that we know with the means that we have and the health and the nutrition infrastructure the country has created and the kind of policies and programs in place, why are we not making a better more faster improvement? That is largely because of implementation failure and poor targeting. These were correctly addressed by Poshan Abhiyan, the National Nutrition Mission, and we were seeing tremendous traction from not just one department. It was truly a multi-sectoral program, ably supported by several development partners, multilaterals and bilaterals. But unfortunately, the COVID pandemic has pushed everything back. But I'm highly optimistic that we have the infrastructure and we are moving forward with the necessary energy to make amends to this, and we should be back. But it requires a lot more attention to keep the children healthy. Right. We should prioritize health and Anganwadi services as the topmost.
But tell me, Dr. Rajashankar, that as an NGO, it's very difficult to work in isolation. You do need to work with state governments and central governments and government agencies. How difficult is that, and how beneficial also? What are the pluses and minuses of working together with government in trying to do something? You must face quite a lot of bureaucracy and all kinds of questions as well. Yeah.
That's right. I think it has to be a mix of, there are several places where the government infrastructure and the machinery is not able to reach. And also, government is excellent in their infrastructure to do what you might call as a product-based services. You come to the center, I'll give you a vaccine, I'll give you a tablet, I'll give you ABC. Right. But then a lot of nutrition has to happen at home. The NGOs and the civil society has to work with the communities to change the community norms. In India, we have 1.38 million Anganwadi centers, but the utilization of services is not even reaching 50%. We can blame that the quality of services is poor, but there is a big thing that the demand for services has to be there. And also, a lot of our work focuses on changing the community norms so that people practice good nutrition practices and they're seeking behavior for health and nutrition services. And also, with all the constraints and limitations that they have, the good practices have to start at home and the community norms have to change. And that's where I believe civil societies can play a big role in supporting government.
जी डॉक्टर शंकर बहुत बहुत धन्यवाद जुड़ने के लिए। वाकई में जो अच्छा पोषण है हमारे बच्चों को मिले, ये आपने बात इसको दोहराया है। अब हमारे साथ एक और खास मेहमान बसंता कुमार कार हैं, रेसिपिएंट ग्लोबल न्यूट्रिशन लीडरशिप अवार्ड। धन्यवाद जुड़ने के लिए सर। आप ये बताइए, जो ये पैंडेमिक का असर हुआ है, इसमें हमने टीकाकरण की बात की, लेकिन पोषण पर बहुत अहम असर है। आंगनबाड़ी का भी जिक्र सुना हमने, डॉक्टर जिस तरह से शंकर ने बताया। आप ये बताइए सर कि किस तरह से हम पहले हालात में पहुंचेंगे, पोषण हमारे बच्चों को मिलेगा, आंगनबाड़ी क्योंकि इससे बहुत प्रभावित हुई हैं।
Thank you so much for bringing me here. I think good nutrition is good life, and during this pandemic time we have realized that it is also a PPE, personal protection equipment. During this pandemic, nutrition disruption has happened, and you are aware that at the Anganwadi center there used to be Village Health and Nutrition Day, and women used to get antenatal services, including blood pressure checkup and many other things, and there was immunization, vaccination, and moreover there was also supplementary nutrition, and for many poor it was a full meal. So because of the disruption, there is an effect on livelihood, and also effect on the pandemic areas, and infection has been compounded. And within that effect, women and children are the hardest hit. And specifically, India, you are aware that India is home to 1/3 of the stunted children, and also India has highest number of wasted children. And around 9.5 million children are from the severely affected malnourished category, who used to be referred to nutrition rehabilitation centers. And since nutrition rehabilitation centers in many places have been affected, so the life and livelihood, basically the survival and the life of the children of the severely affected malnourished children have been affected. And pregnant mother, you know that they need additional meal, they need rest during pregnancy. And because of the gender-based violence has been increased, and evidence suggests that it has a bearing on stunting and also low birth weight. So overall, there is a lot of effect because of this pandemic. Government has tried to address those effects. There is also caste system. There is also home contact, and there is also delivery by Anganwadi workers and ASHA workers at the doorstep. But still, because of the disruption, the things have been affected. And specifically, the Poshan Abhijan, the way it was envisaged, the way it was rolling on, that has been affected, and another incidental effect is the effect on SDG 2 Sustainable Development Goal and also World Health Assembly target, because since India's target or India's achievement is dependent on global achievement, global target. So overall, not only India has been affected, but the global target has been affected on nutrition front.
Sir, you work with the Coalition for Food and Nutrition Security. How has their work been affected in this period?
In fact, because of the curfew, lockdown, so people are not able to visit Anganwadi centers. And one important thing that happens at Anganwadi centers in the convergence, both ASHA worker and ASHA worker, ANM and Anganwadi worker used to come in one day in a month. They used to provide both nutrition and health services. So our volunteers are not able to work with them. Then social mobilization processes have been affected. Then self-help group, panchayats, who as people who used to go, their services also have been affected. And overall, there is a disruption on supplies and services at the ground.
Yeah, no, there would be. Then that would be such a cause of concern. Sir, thank you so much for being with us this evening on such an important telethon. Thank you very much indeed.
You know, Vishnu and Nidhi, in this entire show for the last nearly 2 hours now, we've been talking about the pandemic and how the crisis that it's created, not just child rights, but child nutrition, child immunization. But you know, they say, there's an old saying, a crisis also brings out sometimes the best in us, and often with our children, and we have to learn from them. So this crisis too is bringing out lots of solutions from children, and solutions that give all of us hope. And we'll show you one of them, and there are many, many like this. This young child, Ria, in Madhya Pradesh, she's taken the initiative and control of her own future and of her community. Just have a look at Ria's story.
नमस्ते, मेरा नाम रिया है और मैं गांव नौगावा झाबा जिले की हूँ और हम एक मानदर टोली से जुड़े हुए हैं जिसमें बच्चे अपने अधिकारों को लेकर बात करते हैं। अभी कोरोना चल रहा है तो हमने कबाड़ से जुगाड़ तकनीकी से हैंड वॉशिंग स्टेशन बनाया है। का इस्तेमाल कैसे करते हैं और हाथ कैसे धोते हैं, यह वीडियो बनाकर हमने व्हाट्सएप पर भेजा था। तो हमारे मानदर टोली के बच्चों को बहुत पसंद आया और उन्होंने उनके गांव में यह तकनीकी से हैंड वॉशिंग स्टेशन बनाया। अभी हमारे आसपास के गांव में लगभग 150 से 200 हैंड वॉशिंग स्टेशन बन चुके हैं और हमारा यही प्रयास था कि सब हाथ धोए और कोरोना से बचे। धन्यवाद।
And now we have with us Priya Nair, Executive Director, Beauty and Personal Care, Hindustan Unilever Limited. Thank you so much, Priya, for joining. Can you tell us more about what Hindustan Unilever does specifically with children?
HUL has been working in India across the decades for our initiatives on hygiene, sanitation, nutrition. Since 2010, our brand Lifebuoy has educated more than 72 million children in India on good hand washing behavior. We have reached almost 28 million children and their communities with providing a safe, clean toilet to these children and their communities. On nutrition, we reach out to over 30,000 villages through our Horlicks Swasth Abhiyan program. So really, I hope this gives you some sense of the kind of work that we've been doing, and also our commitment towards transforming the lives of our children and making them more nourished and really providing a better future to our children.
Priya, COVID has brought its own set of challenges in 2020. How is Hindustan Unilever addressing these challenges and supporting the country in a sense?
You know, HUL was one of the first organizations that announced a 100 crore fund towards helping the nation fight the coronavirus. And we did this in March of 2020. And we took a range of measures, and the most important being that as the biggest soap manufacturer of the country, we really took the opportunity to donate almost 2 crore soaps to the vulnerable and more needy sections of our society. We partnered with UNICEF to actually distribute these soaps over 18 states and support these vulnerable sections of the population to fight the pandemic. These soaps have reached the most remote parts of our country, be it, in the far northeast of our country or in tribal areas of central India or in the slums of our urban centers. I think the second is really between UNICEF and us, we developed a national mass media communication campaign, which was called Virus Ki Kadi Todo. And this behavior change campaign really aimed to educate consumers about washing hands, about the importance at that moment during the lockdown of staying at home, or to contribute generously towards the challenge of COVID and the issues that many of our migrants were having across the country. This campaign reached almost 600 million people and actually had very strong results.
Now, Priya, there are some very interesting initiatives as well, in store. Could you tell us a little bit about what Hindustan Unilever has in mind, especially with UNICEF?
So, we're really very delighted with our partnership with UNICEF over the years. They're our strategic partner in our initiatives to protect and safeguard the needs of children. We have announced an additional commitment of $1 million towards these initiatives in wash, health, hygiene with UNICEF. And really our focus between HUL and UNICEF is to ensure that we address these real pressing issues and really leave no one behind in this entire challenge that faces many of our children and help really create a brighter, better future for our children.
Well, Priya, thank you so much, and hopefully that brighter future for our children. It's so important that companies do come into this, and it's wonderful to hear about the contribution that you're making.
और अब हमारे साथ रिया है। कुछ ही पलों पहले आपने एक रिपोर्ट देखी किस तरह से मध्य प्रदेश में गांव की एक लड़की ने हैंड वॉशिंग स्टेशंस बनाए थे। रिया हमारे साथ जुड़ गई हैं। रिया, बहुत बहुत धन्यवाद जुड़ने के लिए। तो जो आपने हैंड वॉशिंग स्टेशंस बनाए थे, लोगों ने उनको कैसे लिया, क्या वो फायदेमंद रहे, क्या कहना था लोगों का?
पहले तो कुछ साधन नहीं थे, लेकिन अब हैंड वॉशिंग स्टेशन बनाया है तो लोग पहले हाथ धोना भूल जाते थे, लेकिन अब घर के बाहर ही है तो वो हाथ धोकर ही अंदर जाते हैं और अब वो अपने हाथों को अच्छे से हैंड वॉश करते हैं, उसके बाद ही घर में जाते हैं।
रिया, ये बताइए कि आपको क्या कोई मुश्किलें आई या लोगों ने इसका विरोध किया? कितने सारे बनाए आपने और क्या स्थिति थी आपके सामने?
मुश्किलें तो नहीं आई, पर कोविड चल रहा था तो हम बाहर नहीं निकल पा रहे थे, तो हम फोन से आपस में दोस्त बात कर लेते थे और फिर हम जैसे तैसे कर ये बनाते थे और हमारे दोस्त उनके गांव में वो बनाया और हमने यहाँ पर बनाया और कम से कम 200-250 हैंड वॉशिंग स्टेशन बन चुके हैं।
रिया, बहुत बहुत धन्यवाद जुड़ने के लिए और धन्यवाद इसके लिए कि आपने अपने समाज को भी जागरूक बनाया।
Wonderful, so inspiring. We've got Dr. Yasmin again with us. Thank you for coming back on and joining us. I think everybody wants to know, that the funds have already got over 1 crore, which is wonderful, but this is going to carry on. People can keep donating over the next 2 weeks. Or 3 weeks actually on our website, ndtv.com. How critical is it? How would you tell the viewers that it's crucial to donate and be part of our children's future, building our children's future now?
First of all, thank you so much, Pranay and Vishnu and Nidhi. We so appreciate your coming together with us to take forward this telethon. And we've heard, you've had a glimpse of what the challenges are, what children are facing, what solutions are out there. Right. You've seen how our frontline workers are battling so hard in the war that you talked about. You've seen how children themselves are coming forward to find solutions to the problems they are facing in their communities. You've seen doctors, lawyers, everyone really appealing to our sensibility, both our head, heart, and our mind to really consider the plight children are facing in this pandemic, which is going to continue. It's not going to be over in a matter of months yet. So it's really important that we appeal to you, that you find a way, all our viewers find a way of really contributing to making children overcoming this crisis they are facing. Whether you have children yourself or you have grandchildren or you don't yet have children, but you remember when you were a child and how important this work is. From our side, I totally commit for UNICEF's, we are not giving in. We will continue to work with the government, our partners, our civil society organizations, and most importantly, with the children themselves. And we've seen private sector companies come forward too. So please, please, please do donate, because it will make a difference in the lives of children. And I know, and I thank everyone who has made the generous contributions so far. A lot more needs to be done, and we really count on your support.
Yeah, absolutely. So much more does need to be done. And hopefully, as we mentioned earlier on as well, this doesn't really end with this 2-hour program. In fact, you can keep contributing in this telethon, and the cause does go on. And so we'd encourage people to actually be a part of that. Well, Ricky Cage is a Grammy-winning composer and UNICEF celebrity supporter, and also Anjana Padmanabhan, the playback singer, and the first ever winner of Indian Idol Junior in 2013, join us. Thank you both. It's great having you. Ricky, let me start by asking you, you've worked with kids from all across India to create this incredible message. It's time to wake up. What is your one big takeaway from that experience?
No, first of all, a huge honor to speak to all of you at NDTV, and it's been amazing working with UNICEF India, and being the UNICEF celebrity supporter. I'm really, really dedicated to their efforts. And of course, the one takeaway is that working with children is always fruitful, and at the end of the day, with all the problems that we are facing on our planet, protecting our children, protecting children's rights, and ensuring children reach their full potential is one of the most basic things that we need to get right before we can think about solving any other problem. So this song is all about waking up and understanding that the future belongs to our children, but not just the future, even the present belongs to the children, and we need to acknowledge that completely.
Bilkul. We have Anjana with us. Anjana, what has been the experience been like for you, not just in terms of performing with Grammy-winning composer, but also in terms of the message you are delivering through this anthem?
I think firstly, I am really, really thankful to Ricky sir, UNICEF and NDTV for having me here. It's so special to be a small part of such a wonderful initiative. I had a wonderful time, and it feels so nice to be able to sing a song which really instills hope and brings in a lot of positivity among people to, think about the fact that dreams can come true and the future really belongs to the future generations. And being a teenager myself, I really understand how important it is, how important every aspect discussed is in the development of an individual. So yes, I had a wonderful time recording this song.
So Anjana and Ricky, I'm so glad that it was a great experience for you, and thank you so much for being a part of this. Both of you are such inspirations to young people across the country, and it was great to have you on this program. And as we run out of time, sometimes the best programs inevitably always seem to be running out of time. We'd like to thank all of you for joining us. Do log on to ndtv.com/reimagine to keep those contributions coming in. Remember, this is for the future of India's children, our kids. The donation details are there on your screen right now. And you can contribute online or via a QR code. These interventions, your interventions, can help save, and I'll say it again, 1,600 children each and every day.
बिल्कुल, ये बहुत ज़रूरी है कि जो हमारे बच्चे हैं उनकी तरफ आप तवज्जो दें, क्योंकि वो हमारा आज है और हमारा कल भी है.
We leave you with this very powerful message of Ricky Cage's anthem, Wake Up.
Thank you all very much.
चढ़ती सुबह है हम मस्ती का तोहफा है अपनी हंसी सारी दुनिया पर छिड़काए छोटे है ये कदम पर ख्वाबों में है दम प्यारे दुलार मिले एवरेस्ट भी चढ़ जाए हो रहा सवेरा हर जगह तुम भी जागो प्यारे हम हैं फ्यूचर ना